Welcome everyone to today's webinar, Re-energizing Your Revenue Cycle. I am Ayla Ellison with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Keith Grubel is President of Business Development at BHG Patient Lending, and Jacob Corleone is co-founder and CEO of Capital Collection Management. At this time, I'm going to turn the floor over to Keith to begin today's presentation.
Well, good afternoon, everyone. Thank you so much for attending, and thank you so much for the kind introduction, Ayla. I really appreciate it. As Ayla mentioned, my name is Keith Grubel. I am with BHG Patient Lending. Just a little background on me, a little introduction, so you guys have a better idea of who I am and kind of the why that we put this presentation together. I've got about 23 years worth of financial experience, mainly in the consumer and commercial lending space. For the last 10 years of my career, I've spent exclusively in the healthcare space with Bankers Healthcare Group. To that regard, a lot of my experience comes from the lending, debt restructuring, debt recovery, risk management, originations, underwriting, and collection standpoint. I am a member of the HFMA Educational Committee for the state of Florida. I am a certified speaker, trainer, and coach from the Les Brown Institute and a member of Tony Robbins Mastery University. You'll note throughout the presentation, sometimes I get a little bit excited and speak a little bit quickly. I apologize for that in advance, as I'm really looking forward to sharing with you all and contributing as much as possible to your knowledge and understanding of what we could do to work together and help re-energize the revenue cycle for the healthcare industry and for all of the attendees on board today. I'm really honored to be joined by Jacob Corleone, and I'll let Jacob introduce himself from Capital Collections Management so you get a little understanding of his background as well. Jacob?
Thanks, Keith. Happy to be here and speaking with you all today. So a little bit of background on myself. I am the co-founder and CEO of Capital Collection Management. I've got over 12 years of experience in the collections industry. I'm currently the president of the New York State Collectors Association, and I sit as a council of delegate to ACA International, as well as holding multiple collection and compliance certifications. And CCM as a whole is a nationally licensed and bonded first and third party collections agency, debt buyer, and litigation service, and very, very much looking forward to, to speaking with you guys further down the line.
Awesome. Thanks, Jacob. Well, everyone, first and foremost, thank you again for being here and spending an hour with us this afternoon. Obviously, it shows a commitment and a desire from you all to grow and improve your organization's revenue cycle and obviously your knowledge. Getting back to a new state of normalcy has been a huge challenge for everybody in the healthcare space. And as our facilities reopen to elective surgeries, as we start trying to create some more new normal for our patient experiences, I think it's very important to understand how revenue cycle plays into that and how these changes are not just happening in the clinical aspect, but in our financial and economic climates as well. Our goal through this organization is to hopefully create a little bit of clarity about some of the opportunities that we have to help enhance revenue cycle, to restart it, to take advantage of this quote-unquote new slate to really help us take control of the revenue cycle a little bit more and help enhance it for our patients and for ourselves. One of the things that I really want to talk about is kind of the state of affairs of the healthcare industry from a financial perspective, pre and post-COVID, or during COVID, I should say. We prepared this presentation quite early on, and to be honest, it's evolved and taken new life. It's almost been an organic presentation as it changes constantly with the changing of guidelines, with the enhancements of government programs, and honestly with a continually changing economic climate that's impacting a lot of our patients. Obviously, we are all very aware of what our partners on the clinical side are dealing with the changes that they're having to embrace, updating guidelines, changing staffing requirements, understanding staffing needs, managing new schedules, and really just kind of working to get patients to come back into our centers, into our facilities for care. Then, not to mention on top of that, all the financial expense related with having to bring people back into the center to be able to prepare all of our facilities with the additional equipment that we need, with the additional guidelines that we're going to have. Add on to all of that, a disruption in the revenue cycle that we've had and all the pre-existing revenue cycle management challenges. It's really made a very difficult opportunity or difficult time for the healthcare industry. And that's really why I want to talk about the industry before COVID and during this COVID conflict. Obviously, we're forced to face a new day. So right now, accelerating a path to consumerism and to reinventing a lot of our financial processes and protocols on the revenue cycle side is going to make sure that we can go ahead and maximize revenue for our facilities, and obviously just to be able to survive and to be able to take care of our patients into the future. Let's talk a little bit about the revenue cycle and the realities of our industry before COVID even began. I think many of you would attest to the fact that revenue cycle has been a growing challenge for all of our facilities, especially in the way that we manage patient responsibility in a lot of cases. We have the advent of high deductible healthcare plans. We have increase in patient responsibilities. Obviously, patient AR has been growing at facilities, and the cost of collecting on that revenue has been increasing drastically. As a slide that you see right now demonstrates, year over year, we're seeing a larger portion of the revenue coming from our patients. Today, about $485 billion is a patient responsibility is billed every year by medical providers. Unfortunately, a lot of times we only see somewhere between 45 and 50% of that patient responsibility being collected. Obviously, that's a tremendous burden on our patients to be able to afford this health care and to be able to find options to pay for it. And it's a tremendous burden on our healthcare facilities that are trying to survive on tightening margins and more challenges and restrictions with higher expenses to provide care. The goal here is to understand how can we help a lot of these patients and a lot of the facilities through the various areas of the revenue cycle to be able to increase revenue, to be able to balance that revenue a little bit, and be able to offer care to more patients. Obviously, as you can imagine going through this, Americans are concerned. Last year, a study was done where 66% of Americans that responded said they were very concerned about losing their health care coverage, and over 83% worried about the cost of their premiums and how they'd be able to afford and pay for their care. Unfortunately, we're getting into a place today where that's becoming a lot of a reality. It's no longer a fear, but it's a reality with the unemployment rates. Today, again, you're seeing huge shifts in the economic and financial climates of the country, and as an industry, we've got to learn how to shift and evolve with that. How does this impact the providers? How does this impact each of your facilities? 73% of providers recently reported that it takes a month or longer to collect from their patients. Only 12% of outstanding balances are collected at the time of service. And it costs 4 times more to collect from a patient than it does from an insurance company. Now, this is all very, very interesting information. And for a lot of people, it seems scary and daunting. But for me, what this presents is a great opportunity for us to change and evolve, to be able to reinvent our processes, to be able to be more customer-friendly, more patient-friendly, to embrace consumerism a little bit more, and to break and depart from the norms that we've been used to for so long. Unfortunately, new challenges often have to call for new results and new solutions. So we have to get comfortable right now discussing a lot of the financial responsibilities and challenges. We've got to embrace it a little bit more. We've got to set expectations for the successful outcomes of our patients and of our facilities. When you're looking at these, the amount of money that it takes for providers to collect, or the amount of time it takes for providers to collect from patients, right now, in an environment where we've had disruption in our cash flow, an additional months of waiting on AR is critical. It's days that we really don't have, and it's monies that we really need to collect up front. When you're looking at the amount of collections that we're collecting up front right now, it tells us that there's a great opportunity for newer solutions in our revenue cycle so that we can collect up front and make sure that we're getting the patients at least a good understanding of how they have to pay and what we could do. And as far as how to collect from patients, well, this tells us that we've got to do a better job of managing and mitigating the collection costs. We've got to embrace better tools, not just at the patient level here, but at the payer level overall. And we're going to step into that a little bit further on in the presentation. As you can tell, the timing is very relevant for us to be talking about financial responsibility, to be talking about consumerism in healthcare, but not just talk about it, but really to embrace it and do something about it. As I mentioned earlier, these slides are kind of organic, and this presentation has been a live evolution we see that these numbers, unfortunately, are changing every day, and oftentimes what they're doing is actually climbing. For example, on Friday, this first statistic that you see here that says 40% of patients said the state of the economy affects how often they seek medical care. On Friday, we saw a statistic published by Becker's. It said 48% of Americans surveyed in mid-May have avoided care due to COVID and due to the costs related with it. So compound the fact that people are financially concerned with the fact that people are scared for their well-being and their health care means less patients are coming into our facilities to receive care. That tells me that we've got to be able to maximize revenue on all sides and enhance the revenue cycle to be able to create the best outcome possible for every patient that comes into our center. As we know, a larger percentage of the revenue is coming from the patient's pocket directly these days. And a lot of patients that are insured are not reaching their deductibles. All of this supports the fact that patients are avoiding oftentimes necessary care because they're scared of the cost of being able to manage the affordability of this. So we've got to really begin creating affordability in a lot of our plans, and we've got to be able to create flexibility for patients. We've got to start investing time and energy into revitalizing our revenue cycle processes so we can maximize the patient comfort level, so we can ensure that they're coming into the facility knowing that there's a way to afford their health care, and so we can make sure that we are providing solutions that are not only beneficial for the patient, but obviously for each of our facilities as well, maintaining a patient-centric approach to the revenue cycle, but enhancing revenue as best as possible. I read an interesting statistic earlier today. It said 31% of Americans, as of the middle of this month, have stopped paying their bills, like medical bills or medical insurance. That really startled me because it told me that we've got to start finding newer ways to create affordability for these patients and to be able to make sure that we're collecting as much revenue as possible from all aspects of the revenue cycle. So how do we start preparing for a new world? How do we start managing a world that has potentially shrinking volume, less employed patients, more patients uninsured or underinsured than ever before, a rapid evolution in the benefits that patients are actually using? It changes our entire revenue cycle. From the provider side, obviously you're seeing temporary income losses due to the COVID challenges, potentially closures due to COVID restrictions, or limited in patients coming into your hospitals and facilities as a result of COVID. Add on to that the fact that you have an influx of claims to our payers. Our payers right now are probably seeing more claims than they ever have in the history of our payer system. And so what does that equate to? And obviously an increased need to accelerate the cash flow for the providers so we can make sure that we've got these claims coming in and we have the reimbursements to afford to continue to give care to our patients. On the patient side, as far as increasing unemployment, recent estimates are saying that we're as high as 23.9% unemployment rate in this country, which is extremely frightening. The number of people that have filed for unemployment claims since mid-March is just under 41 million Americans, and patients are losing their benefits at a record rate. Many of them that are losing them are not qualifying for government plans either. It's estimated that in total, only about 79% of unemployed people may be eligible for publicly subsidized insurances in May. What does that mean for you? That means that there's a changing patient and payer mix. That means that we have to start embracing different areas of the revenue cycle and looking at every opportunity that we may have to succeed. Stepping into that really sets the stage for what we want to be looking at and how we want to address this presentation. There's a lot of information that we want to touch on to create a patient-centric revenue cycle. And I see many of the questions coming in. We will be distributing this deck out to everyone after the presentation. But in short, what we want to touch on here is just to really help you understand what are the perspectives that we have on re-energizing the revenue cycle. What can we do to create that patient-centric approach and apply changes in every area of your revenue cycle? Very simple and easy ones before you get more in depth. But these little quick tips that might be able to help improve financial outcomes for your facilities and maximize your revenue while, again, keeping your patient at the forefront of everything that we want to cover. So these 6 areas have a lot of information in them. We're going to try to pack it all in to be respectful of your time and make sure that we have enough time at the end of the presentation for the Q&A. Apologies if I'm going a little bit quickly, but please continue to participate in that Q&A, and we're going to get to as many of those questions after we're done with the presentation so we can go ahead and answer them. So let's talk about the first step, price transparency. I think when most people hear price transparency, the first thing that we think about is just creating a place on our website where we can put our charge master or listing all of our expenses. But price transparency goes way beyond that to me. Price transparency is not just about setting some standards to make sure that we're complying with the guidelines, but it's really about creating an understanding for all of your patients as to what they're paying and why they are paying it. It makes it very difficult for a lot of patients to go into the healthcare provider when they really don't have any understanding of how their benefits work, of what the charges are and why they're paying them. To the point of price transparency, only about 20% of providers right now are using a price transparency tool, or a tool that creates estimates for patients to have a good understanding of what their financial responsibility is. I think that's why you see 75% or 3 out of every 4 patients don't know what the cost of their healthcare bill is until they receive it. That's pretty scary, because a large majority of your patients are saying they want to know what their payment might be. They want to understand what their responsibility is prior to arriving at those visits, if possible. Now, obviously, in the hospital settings, in emergent care settings, we won't have that benefit. But if you could find ways to create transparency at the point of discharge for those patients and just give them an understanding and an estimate of what they may be responsible for, you eliminate a lot of the uncertainty, and you still can start providing some good ideas as what the cost will be. At the end of the day, there will be a cost to patients. Communicating it is the most important part possible. We want to make sure that we're opening up the doors to communication and creating a positive understanding of what the cost of care is. It's very easy to understand and see the negative effects of price transparency. If you do not offer price transparency, or if you're not giving good estimates to your patients, well, first and foremost, the potential loss of market share. Consumerism has been a big conversation. People are shopping more and more for where they receive their care. And one of the things that they shop for is understanding what their patient responsibility is, how much it will cost, and how clearly it's explained to them. So making sure that you're understanding how to explain those costs to your patients and getting some information to them up front with a good estimate will absolutely help you maintain some of your market share and make sure patients are satisfied with coming to your facility for care. Unfortunately, the financing piece of healthcare becomes one of the largest drivers of patient satisfaction. Because the reality is that as great as the care that we pride ourselves in offering is, and as much as we strive to create an extremely high level of patient care in the centers and in the facilities, the financing is the last thing that the patient remembers. So giving them an understanding of what their balances are, what their responsibility may be, would give a tremendously better patient experience. And that's 65% of patients telling us that they would go to a different provider for a better payment experience and more clarity in their pricing. And ultimately, the confusion of what's owed. Oftentimes, 30% of times you see that delayed medical treatment is because people don't know what's covered and what they owe, what they may be eligible for as far as care, and what their premiums will entitle them to. So I encourage you not to just inform of price, but engage in the affordability conversation as well. It's not just a matter of creating transparency about what's owed, but it's about creating confidence as their healthcare provider, a holistic approach to their care and saying we can provide you state-of-the-art best care possible, and we can talk you through the financial implications of what that care is going to cost and how long that might be. You've got to become a leader of discussing financial estimates so that you can create success for those patients. Obviously, in the acute and emergent care sections we talked about, talking about them at time of discharge is probably the best place to do it. I know many hospitals that I've worked with and health systems prefer not to discuss financing as much at discharge and prefer to mail a statement later on down the road. If you at least discuss the costs and the options that are there, you may be able to get a higher patient adherence to your payment plans, and you may be able to get a better result in the revenue collection. That having been said, I'd like to leave you with the first tip on this point, which is to make sure that you provide estimates to your patients. If you can do it pre-procedure, even better. It's interesting to know that 65% of patients said if they knew what their cost was or had an estimate of their cost, they would make at least a partial payment up front of their responsibility. That is tremendous to know, because we talked earlier about accelerating upfront collections. We talked about how important it is to be able to collect more revenue upfront to get some more adherence to your payment plans. This is an absolute easy way to do it by simply providing an estimate to the patient and asking for them to make some sort of a partial or down payment. Again, at the point of discharge in the acute settings, you can implement a very, very similar process. Whereas opposed to waiting until post-care and discharge and mailing statements after the fact, we can at least present an estimate, as many people are starting to embrace, and start offering a collection portal or payment option at that time so the patient can begin getting used to the idea that there is a responsibility here that's going to need to get paid, and that we have to go ahead and make sure that we are paying it upfront and on time. I would encourage everyone to research estimation tools and benefit calculators. If one isn't available to you or it's not in your budget, work on infrastructure changes to create quicker estimates if you're doing them manually or over the phone. Create business processes that support informing every patient of the estimate before the procedure if possible, before care, or at point of patient discharge, so that they go home with at least a good understanding of how to manage their responsibility. Moving on to our next topic, the patient financial responsibility is a tremendous one that we continue to see pop up. As mentioned early on, this is one of the more challenging places that providers are struggling with collecting, and this has happened pre-COVID and now, unfortunately, during and post-COVID, as the unemployment rates continue at all-time highs. This is becoming a bigger and bigger challenge. Again, when approximately 30% of the revenue that comes out of any procedure is coming from the patient, this becomes a very high-value dollar to collect, where previously it may have gone a little bit overseen and it may have been the elephant in the room that nobody wants to wrestle with or deal with because of the implications of pushing too hard to collect from a patient or being seen in the market as a collector or the provider who chases people for payment. We're coming to the realization that we can't afford as a healthcare industry to continue operating and ignoring these dollars. We have to really get much better at being able to provide flexible solutions for these patients. As hard as we try, only 50% of patients are paying financial responsibility. So again, we estimated earlier, somewhere between 45 and 50% of patient responsibility is never collected at all. Industry averages say that in some areas put it much lower than that. I've seen some studies that say it's as low as 29% at healthcare systems and hospitals is being collected. Today, we can't continue to ignore those dollars, as I mentioned earlier. We've got to be able to create, as healthcare providers, partnerships that are going to get you out of the banking industry and allow you to focus on care. For a long time, as high deductible health plans evolved, I think many of you can agree that we saw the care providers stepping to the front lines and saying, we'll figure out a way to create affordability for our patients. We'll create payment plans for them. And in doing so, we've increased our out-of-pocket, or our AR on our books. We've seen patient balance AR climb astronomically over the last couple of years. And the options that we put out there in good faith, unfortunately, are not yielding better outcomes than we anticipated. In the outpatient centers, on average, you see a 3 to 6 month payment plan. The reality is that, unfortunately, for most Americans, a 3 to 6 month payment plan doesn't cover it doesn't make affordable their payments on a $1,500 out-of-pocket responsibility. Some out-of-pocket responsibilities are estimated to be higher to $2,500 in the acute settings. If you break that up over a 12-month payment plan, which is what most hospitals offer, patients still can't afford it, and we see that in the data. 89% of patients report that they cannot afford a 12-month repayment plan on their healthcare costs. While our intentions are good and we're trying to drive into a solution that helps our patients, unfortunately, we're taking on a lot of labor, we're taking on a lot of costs to find out that it doesn't get the outcomes that we hoped for. And so we've got to find more flexible ways and more beneficial partnerships to create affordability for the patients. By the way, I think it's always very important to note that patients want to discuss financing options. I think that for a long time, in healthcare, we were a little bit concerned in not discussing the business of healthcare and the cost of healthcare with the patient, because historically it wasn't a large percentage of that the total revenue amount. As the patient responsibility portion grows, we have to embrace those conversations a lot more. When 50% of our patients want to discuss financing options, and only 8% of them report having received a low-interest financing plan last year, That's a big red flag for all of us to make sure that we are doing a better job of over-communicating to our patients. The reality is that our patients want a way to afford, but they need a way that's affordable for them. They need options that are flexible and that are more moldable to their budgetary needs. We've got to make sure that we continue to articulate these options to them, that we find the appropriate partnerships, and that we embrace that consumeristic approach to not just talking about how great the care is that we offer, but to how well we can help them afford and manage the financial challenges that come along with receiving healthcare in this country today. Side note, which is very interesting, obviously, in that last statistic, is that the number one reason for people not paying their medical bill is a lack of a financing option. So the second tip I leave you with is to make sure that your financing options that you have today are covering all of your patient demographics, that it's creating flexibility and affordability for every single one of your patients that come in. If your patients are in a low-income demographic or uninsured, have higher out-of-pocket responsibilities, we've got to get a program that gets them approved, and we've got to get them a program that allows them to afford their patient responsibility over time. Make sure that we're looking for unconventional solutions for the unconventional problems that we have today. We're not living in a traditional economy like we've enjoyed for the last 10 years, excuse me. And even at that, we know that that economy has been very good in many areas, but we still have struggled with patient responsibility and flexibility in collecting from the patient. Going into a more challenged economy is even more important than ever to make sure you have a flexible solution to cover for all of your patient needs. And that feeds right into our next point, which is the convenience of the payment. Patients are so much more technologically savvy than we were before. I think everyone has been forced, just by the advent of the cell phone and the popularization of cell phone applications and communication tools, to jump into technology with 2 feet. I joke often, but I'm quite amused when I learn a new app or a new way to manage my phone from one of my parents. It's hysterical to me that in their late 70s, they're still engaging with technology, and these are people who never really owned a home computer. But because of how quickly technologies have advanced, they now need to learn how to live in this technological world. When we're talking about that, we have to realize that payment convenience is a big thing for many patients. It's unfortunately become shameful and embarrassing for people to pick up the phone and talk about their finances often. They're at work, they're in front of family, they don't want to talk about their challenges in making a payment or when they're going to budget it. But if we put it at their fingertips, they're much more likely to embrace it. Now, how does COVID change this? Well, add to the fact that we want to be as hands-off as possible, as touchless as possible, and give touchless options. I think it really just speaks volumes about how we have to reimagine the way that we collect payments and really embrace technological communication tools. Obviously, all of the traditional methods of collecting payment that we've seen historically, whether it's collecting cash or checks or credit cards, we have a high touch point there, number one. We have a large potential for infection that we're trying to avoid, but it's also limiting the amount of patients that can afford to pay for care if you're not receiving or not taking any kind of a payment option and you're not getting any flexible options. If you have credit restrictive programs, only a portion of your payments patients get approved. And so you have a challenge with finding a solution that solves for everyone. In-house payment plans, unfortunately, are very timely to manage. They're very costly. When we're looking today at the cost of our human capital on a day-to-day in all of our facilities, we need to understand that in-house payment plans, unfortunately, are very costly to manage. Traditional contact mediums don't apply anymore in this market. We have to be looking at communication tools and ways that we can more readily automate and leverage technology, not just from the tool that we're using to collect, but the medium that we're collecting it through, and making sure that we have mediums that are allowing for our patients to be able to interact with us electronically on their timing, at their leisure, and in their budget. So a couple of things when you're evaluating financing options is making sure that you're looking at the true cost to manage and collect on your payment plans, understanding if they're creating flexibility and ease for your patients to make those payments, and really understanding if the patients are getting the care and support that they need, if the financing tools that you're giving is an extension of the care and support that you want to extend from your facility. Are they getting easy access to financing? Does it create a positive patient experience? Any of your financing options and tools, whether it's internal or external, is it serving as an extension of your facility? These are important things to understand when we're looking through how to communicate these patient responsibilities, how to collect them, and creating convenience for all of the patients. That brings us obviously to our third tip here, which is to make sure that you're providing payment options that every single patient can appreciate, whether that's online via an automated service, whether it's a portal or an application, but touchless ways and touchless mediums to communicate and to collect those payments. Getting creative and untraditional to allow the patients to choose their best path to success is very, very important to make sure that we get as much patient collection as possible and that we're allowing the patients to communicate to us in the medium that is most convenient to them. Technology for reminders to collect as many dollars as possible before using human interaction, which is obviously carrying higher cost to it, is going to be a big change for us in the healthcare industry as we start engaging it more closely. As far as payer reimbursements, and we've spoken a lot to the patient side of things, payer reimbursements are obviously becoming even more critical, even more important to manage correctly. Recently, there was an HFMA study that was done, and 39% of the people that responded said that as part of their post-COVID or COVID reassessment of revenue cycle, one of the biggest things that they did, 39% prioritized payer rate negotiations. That was on their radar as the highest priority of how to manage some of their financial challenges in the revenue cycle. We've got a ton of challenges coming at our payer system today. The reality is that our payer system is being taxed at a rate that it's never experienced before, as I mentioned earlier. You have more patients coming to the systems with more claims than they've ever dealt with or experienced, probably in the history of healthcare and definitely in the history of our insurance system. And while the payers are making great strides to accelerate reimbursements on COVID-related items, we are obviously now opening all of the elective surgeries back into the market. We have a backlog of patients who are fortunately coming into our centers, into our facilities, back into the hospitals. Normal care is coming back, and you're realizing that it's going to create some stresses and challenges on the system. There's an article published on May the 27th, just a few days back, that said that experts are expecting claims to spike in the next 2 to 3 months. That's going to delay reimbursements due to the volume. So the question is, how does that reimbursement delay start impacting your facility? If you're not managing your claims as best as possible, if we're not training consistently on our claims and making sure that we're minimizing any denied claims or kickback claims, we're setting ourselves up for failure. This is a great opportunity right now to start working with all of our teammates to start educating, not just when they go for their continuing education credits once a year, but continuously on how to help enhance the collection rate or the approval rates of the claims that we're looking at. More importantly, the article that I was referring to earlier that was published on May 27th said that one of the things that's going to be impacted very substantially as a result of COVID is reimbursement rates in 2021, which means that now we have to start getting ahead of this much more aggressively. When you're going through your payer claims, be familiar with your contracts. Make sure that you're understanding your timelines and that you're filing things in a timely manner, that you're following up on all of those claims and making sure that you're capturing every claim possible on your procedures. Cross-reference any reports that you have internally and start making sure that what you're billing or what you're billing for is being reimbursed in a timely manner. Do not let claims sit for too long if they're inaccurate, incorrect, or incorrectly reimbursed for. Make sure that you're staying on them as quickly as possible. Obviously, leveraging as many electronic claims submissions as possible gives you a great paper trail and an easier way to access reporting and manage it. And reviewing for accuracy, to me, is one of the biggest areas that we can look at. You can reduce a lot of your lost time and money by looking at how many claims you're resubmitting and understanding where your resubmissions are coming from. If you're in a ambulatory surgery facility that specializes in a certain area of care, look at your mix of procedures and understand what is your greatest volume of procedures. And from that greatest volume of procedures, that's where you want to start. Looking at those claims and making sure that they're as accurate as possible, that your team is trained on them, and that we're making sure that we get the claims to come through as quickly and cleanly as possible. Some interesting facts on the impact of denied or incomplete claims. 63% of the denied claims are recoverable with an appeals cost averaging about $118 per case. So essentially, any time that there's a denied claim, 63% of them you'll recover, but it's costing you an extra $118 on each of those cases on average to go ahead and collect or recover those appeals. That's a lot of money when you start adding it up over time at your facility, especially for you higher volume facilities or you high volume hospitals and health systems. That can add up to a substantial amount of savings that's easily managed by reinvesting in some of your training and working with your team. Again, look at your volume of claims and each claim type and train specifically to what is most commonly denied and how to evolve it. Look for consistent and ongoing training and look at best practices from your high performers to figure out how you manage those claims even better. 19% of claims that are processed are denied or need resubmission. That's a tremendous amount of revenue that's potentially lost or delayed. And up to 60% of the claims that are kicked back are never resubmitted, which is even scarier. So that's all revenue and money that's sitting on the sidelines. Little tweaks and attention to detail and management of some training and infrastructure can help manage those monies and find that enhancement in your revenue right there. So the tip for this is to make sure that you're looking for those current claims process enhancements. Gather feedback from your higher performers. Look and grade or rate your employees on how many times their claims are kicked back, how many times their claims are gone through cleanly. Understand some KPIs and start modeling that good behavior. Start understanding what those employees do differently to ensure that your claims are processed in a quick and timely manner and that there's a better way to create or to not lose the revenue that's sitting right in front of you. That brings us to the next portion, which is our patient AR portion. So the patient AR portion, we're talking a little bit more towards existing patient AR. I want to touch back to that survey I mentioned earlier from the HFMA. And when they went out there, 57% of respondents said one of the biggest ways that they felt they could enhance their revenue is by looking at their patient AR and enhancing their revenue and collections models in those areas. This is money that's sitting on the sideline that we oftentimes work through a standard process, but we don't really evolve as quickly or as readily as we should. We're not pushing on the patient AR because maybe our current existing policies don't fit with what the economy needs. Maybe we are not aligned with the best interest or the best tools to provide an ease of collections for the patients. In a changing economic climate, you've got to make sure that you're managing your existing AR even more critically. You have to realize that these patients who may have had a challenge paying you before are even less likely, unfortunately, to be able to pay you. And starting to understand where the bad debt lies, in what timelines, and how to line them up with potential outside expert sources that can help enhance that revenue is very, very important. Now, obviously, the first step is to avoid having existing AR. And how do we do that? Upfront collection tools, upfront origination platforms, by leveraging some of the partnerships that may be out there to help you collect patient responsibility up front, as we discussed earlier in the presentation. Offering down payment plans and partnering with more flexible partner programs to be able to secure financing for all of your patients and create affordability for them is the best way to start avoiding that. In the event that, unfortunately, it's not collected up front, you've got to maintain your follow-up. One of the biggest challenges that we see with healthcare facilities often is that what we've always done is what we always do, and we have a hard time evolving our collections process out of a desire to not be perceived as a collector or too aggressive in the market. But I really believe that if you set expectations with patients and you're consistent in your follow-up and approach, and it's in line with your financial policies and strategies that the patient is understanding of, educated on, either before services or post-discharge, or at discharge rather, you're going to see much greater level of success. Following up is the most critical one. Number one, if you have patients that may have qualified for financing options that they have not taken or received, following up with them and understanding why. Obviously, making sure that you're taking advantage of third-party tools that make those communication mediums easier, whether those are call platforms, texting platforms, ways to easily and efficiently communicate with patients to make sure that they know about the options that are available to them and present it to them, whether that's an email, a text message, anything that maintains within compliance, obviously, but gets to go ahead and communicate with that patient more readily, more effectively. That goes back to step number 3, or point number 3 here, which is make sure that you're communicating through multiple channels. Oftentimes we see that collections activities happen through one phone call and a series of mailed letters, which get extremely expensive to continue packaging and mailing and don't yield a much more positive result. As opposed to waiting for that account to become 60, 90, 120 days delinquent before getting more firm in your collections activities, try accelerating that. Try mixing in more mediums than just your traditional mediums to make sure that we're communicating with those patients and leveraging all the technology platforms that are available for them to be able to touch them, excuse me. So I really encourage everyone to embrace those new tools and partner with people that can manage the communication to your patients in a compliant manner and obviously in an ethical manner that is indicative or that is a continuation of the service and care and experience that you've given to them. The other big thing that I want to continue to talk about is the down payment. Consider implementing a down payment policy for every patient before they leave, at least requesting a down payment. Again, in the elective care procedures that we're scheduling beforehand, request a down payment and decide on a financing option that's available for the patient. If it's an emergent care situation and they're being discharged, ask for a down payment on whatever their balance is. By securing at least a partial payment up front, you get a much higher probability of patients paying through the end of their debt, at least to a much higher level. It minimizes your AR. It makes sure that you have a less amount of AR moving on each file over, and it helps get the patients to understand that financial balance and responsibility is theirs to pay, and that they have to make those payments. There's some great studies that talk about the psychology of repayment when you at least secure a few dollars up front as a down payment, because it's a subconscious commitment to making good on the liability and debt that's there. So I think that down payment policies are ones that everyone should look at into their financial policies or adding to their financial policies to better understand how we can accelerate patients to adhering with these payment plans and to making sure that they comply with them. For our next segment, I want to step over a little bit into the billings and collections section where Jake, with his various years of experience at TCM, is much more suited to speak to. So I'm going to hand the microphone over to Jake so that he can manage the remainder of this presentation and run through the patient billings and collections portion. So Jake, the floor is yours.
Thanks, Keith. Appreciate that. Great points and great overall presentation and insights. Thanks for sharing all of that with everybody. So real quick, I'm just going to hit high level what TCM is, a little bit why we're different, just to give everybody a perspective here. So again, we were founded in 2013. We're nationally licensed and bonded, first-party and third-party collections agency, debt purchaser, and we have a litigation service that we provide as well. Our whole goal and our whole mentality is to really set out and change the face of the collections industry. For far too long, it's had a black cloud over it. We say, forget everything you know about collection agencies. Our people are customer-centric, we talk human, and I know it's going to sound cliche, but it's our belief that a patient should be treated with empathy and provided a concierge experience so that we can get them back on track and get them to be a valued customer to our clients. Our business model has been built on the premise that we should rethink, reimagine, and recover an industry that is vital to our economy while recovering the funds owed to our clients. So, when we talk about billing and collections, it's, evident that it's a very important and integral process, and there's huge pain points within the medical space. So if you look at some of the statistics that Keith brought up earlier in the presentation here, as well as, some of these statistics here. So 77% of providers still use paper-based patient billing methods. I can't stress enough that that is not very effective. There's so much more technology out there. Even, with the advent of the cell phone, you have the SMS capability, you have email, you have web portals. Sending out billing statements, requesting, balance to be paid in full and sending it repeatedly over months, maybe it changes colors a couple times during that process, is really not an effective collection mean. You see that 52% of patients prefer to receive medical bills electronically, kind of going to that point of, the patient billing statement is not super effective. You do need to look at more electronic means, those emails, those SMS options. Definitely look at vendors and technologies that you can bring on internally to help with that. And then 68% of patients failed to fully pay off their medical bill balance. And then you pair that with, some of the other statistics that Keith talked about as well. 40 to 50% of, healthcare debt goes uncollected. That's a lot of revenue there missed out on. So when we really get into, the collections process and the approach, we'd like to break it down into really look at personalizing your collections approach, to your patient base. So are you taking patient preferences into account in terms of how they would like to be communicated with? You should be looking at possibly adding some questions about that into your patient admittance documentation. Because if you can channel your communications and channel your billings into a method that your patients want to be communicated through, it's a home run, and you'll get more engagement through that. Then you look at is how you are sending things out. Does that really align with the methods that are providing the better results? So someone could also say that they'd prefer to receive, something in the mail, but are you really getting that response that you're looking for out of that? Maybe you would then try to send it via email. So it's constantly looking and evaluating at how you're doing things to improve the process. And then, really looking at different tools that are available is also a great approach. There's so many different technologies out there. There's so many different ways to communicate and vendors to use to really help streamline that process. So then we're hitting our tip number 6. So this is really where our expertise comes in, and that's tip number 6 is focus efforts heavily on the first 30 to 60 days. Look at leveraging a partner after 60 days. But when you're looking at the first, from day 0 to day 60, I think you really have to take a proactive approach. So when, the patient estimation tools, giving people an idea of what their estimated out-of-pocket expense is on day 1 is huge. There's a lot of, we hear a lot of people that are like, well, I didn't know I was going to owe, $2,000 at the end of this. Or I would have been able to plan, for this potentially better. So giving them, that bit of detail on the front side is definitely needed. And then you can, again, as Keith alluded to, ask for a down payment. Create a down payment program that will help reduce your AR over time. Again, sending a billing statement via a different color letter or a letter in general, not necessarily the best way to do that. You do want to look at having a trained and dedicated staff that's really handling this. If you have staff members that have, other job functions within your centers, they can really get distracted, and collections and engaging and working with people on a human level takes time, and it takes training, and it takes resources, and it takes a lot of energy. So you really want to make sure that you have that dedicated group of people doing this. Another thing to consider here is looking at this like a profit center. So collections is often looked at as, kind of a necessary evil and is kind of pushed on the back burner. No one really focuses on it. So when you're looking at your AR, we really suggest you look at it like a profit center. Create reporting around it. Create benchmarking around your internal team. So if you're going to have a team of collectors that do, say, day 1 to day 60 or day 90, have benchmarking around that. Set goals, create dashboards, meet about it regularly, make it known to the whole organization, because that will really put the focus that you need to really start to drive performance there. And then again, look to engage with a reputable collections partner to help. So where we come in is we're able to really alleviate the administrative burden associated with, handling all of the collections. As you have new patients come in, there will be more AR that builds up. So you want to have kind of an overflow valve to where you can send accounts out to somebody else to handle. And then again, if you're looking at your AR as a total number right now, chances are you have a lot of AR that's sitting out there that's, 1 or 2, 3 years old. That's a great, opportunity to kind of take a look at that and potentially evaluate, whether you would like to sell that debt to a reputable debt buyer. So then we move into some key takeaways. So this is, a little bit of a playbook that you can go back to your center and kind of assess in your current AR and collections and billing process. So our whole belief is evaluate, assess, and review. So what you're going to want to do is evaluate your process. So you're going to look at, everything from patient admittance through billing and collections, get key stakeholders involved. It should not be something that's done from the top down. It should be something that, you're getting input from the people who are actually doing the job on a daily basis. They're going to have a lot of actionable intel that you can take away from their experiences and really, add to your evaluation phase. The goal of this is to create an outline to work off of through the assessment phase. So we suggest that, again, you kind of go into this assessment with that outline ahead. And you're going to look at your patient admittance documentation and process. What's very interesting is as you start to look at leveraging new technology such as SMS, for instance, you want to make sure that you have proper TCPA disclosures within your patient admittance document that will allow you the consent to send them text messages, and which will then pass through to your vendor if you're going to use a collections vendor, and it will pass that consent over to them so that they can use that technology as well. Very important. And then again, as you see patients over time, always very important to get updated contact information, because things do change with people. They change cell phone numbers, they change emails, so it's very important to stay up to date. Billing. So looking at that, making sure you're on, you have the right platform, you have the right mediums that you're able to send these statements out through. So again, looking at the electronic type mediums, you want to look at email, you want to make sure you have a customer portal, you want to be able to, send notices and information out via SMS. So collections. When we're looking at collections, it's very important to have a consistent and well thought out, well documented process. So looking at this as a profit center, you're going to develop reports, migration reports, charge-off reports, staff collection performance reports, very important. Create a dashboard so that everybody can see the numbers. Again, we're a firm believer internally within our agency that, the more people that see the numbers, the more people that see a goal, it's the more people that are really pushing that positive movement towards that goal. So you want to do the same thing on this. And so with that, you're going to want to evaluate and set KPIs and benchmarks for that team. And then keep that process very, very consistent. So you want to be able to, as your employees are going through this, that they know what they have to do. Have scripting, have a kind of a cadence for communication. So maybe it's going to be, you send out an email with that initial patient balance, and then you're following up with phone calls, and maybe you send out a text message here and there. But again, making sure that's well thought out and scripted. And then you want to make sure that you're creating scripts for your collections, internal collection staff to work off of. You don't want those people to really sound robotic. You want them to really be able to talk human. So giving them a nice outline, giving them a nice system to work out of really helps with that. And then again, like I spoke to earlier, really looking to leverage a reputable collections agency as that overflow valve. Again, it also adds an additional talking point for the staff internally. Maybe, you set that cutoff at 60 days, so then the staff can start to message, at 60 days, we're going to have to send this to, our outside collections agency. But, we're definitely able to do, XYZ for you today. And if not, we will have to send it out at that point. Again, a very good a good leverage point there that we see a lot of clients get traction from and increase collection rates on their AR. And then again, look to potentially sell some of that aged AR to a reputable debt buyer. Great way to really clean up your books. So then we look at the review portion. So this is very important as well. So when you look at creating a new process, evaluating what you were doing, creating a new process, making improvements, it's very important to continue to review that, because you're going to want to make changes over time, based on certain things. How we did collections before COVID is not how we're going to want to do collections during, and maybe not how we're going to want to do collections after. So you want to have that dedicated team looking at, these different things, looking at the reporting, which is why it's so important, and really improving, assessing, and making those changes real time on the fly to make sure you have a really streamlined process. And again, it's also looking at your vendors. Do your vendors line up well with your culture and your expectations and what you want to get out of your collections, the collections of your AR. So again, that review process can go from your internal team all the way through all of your vendors. But you want to really maintain a focus on that as well. And that really wraps up, my overview here of collections and billing and some of the key takeaways that you should take back to your centers and kind of look at.
Thank you so much, Jacob and Keith, for the fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We've had several questions come through throughout the presentation, so I want to go ahead and jump in with a couple of those now before the top of the hour. So the first question that we had come through is for you, Keith. And the question this person has is, do you think that the high rate of patient bad debt is due to their perception that the price is illegitimately high?
Well, that's a great question. I think there's somewhat of a correlator between what people perceive as a fair and true cost for healthcare and their desire to pay it. And obviously their desire to pay that debt will ultimately dictate what percentage of it winds up going to bad debt. I think it points to one of the comments that we made earlier in one of the tips that we had, where it was really starting to educate patients on what makes up their bill. I've gone as far as with some clients of mine said, if people don't understand the bill, they're very, very unlikely to pay it. And we see that statistically. And so how do you start overcoming that? Unfortunately, a lot of our traditional means of, posting something on our website or just kind of adding a piece of paper into their packet isn't often enough, because people unfortunately don't like to admit to what they don't understand. So I do believe that explaining much more clearly what their total costs are for care and why their costs are divided as they are is really important. And I know that it's a challenging situation, because we don't want to invest a ton of time chasing down a patient, or I shouldn't say chasing down a patient, but explaining to a patient how their healthcare benefits work. And oftentimes we feel it's the responsibility of the payer. But I think there needs to be a level of collaboration there, for the simple fact that if we don't do our part to educate people as to why they're having out-of-pocket responsibility, what the true total costs of care are, well, then ultimately, if they don't pay, it's only you as the provider who suffers that cost, that lack of collection for that revenue. So I do think that there's a portion of the reason that debt goes to the bad debt bucket is because patients don't fully understand it. I think that there is some really great, easy ways that we could create high-level conversations with our patients when they're being explained their patient responsibility, to educate them a little bit further and help them understand why there is a responsibility coming out of their pocket, what the deductible is all about, and how that works.
Thank you so much, Keith, for that, walking us through that and kind of explaining your perspective and what you've seen there. I think we have time for one more question before we wrap things up today. And this question that came through is for you, Jacob, and this person's wanting to know just what's your perspective on texting patients while in third-party collections, and what about emailing with prior consent?
Yeah, so that's a great question. So, when you look at, the technology that's out there, the third-party agencies should be utilizing both, being able to text message as well as, being able to email. But again, it really goes back to, those disclosures that are on the center's patient admittance documentation. So you want to make sure you have very robust TCPA disclosure language in there, where that patient is giving consent to be contacted in a collections capacity via SMS and via email by the center, as well as any agents or assigns, because that's really what will give that third-party agency kind of the green light in being able to look at those two mediums as an option for communication channels. But then you really have to take it an additional step on, from there too. And then if someone wants to communicate via SMS and email, they probably also want to be able to a certain extent, self-service their debt. So you want to make sure your agency also has the platform for somebody to also, self-service their debt without necessarily talking to, a live agent. Maybe that's a web portal, or maybe that's some sort of AI, chatbot type of thing.
Great, thank you so much. And we've had a lot of other questions come through, which unfortunately we're not going to be able to get through all of them today. But before we wrap things up, Keith and Jacob, I did want to ask, do you have any final thoughts you'd like to share with all of our attendees today?
Sure. Jake, do you want to kick it off?
Sure. Yeah. So, kind of final thoughts here on the collections and billing side. Really, just take an internal look. Really put, the spotlight on your accounts receivable and billing functions, and really try to improve that process. And then look at your vendors too, and make sure your vendors support your strategic goal and your mission. And I just want to thank everybody, for the time, and I hope everybody has a great rest of their day.
Thanks. So, again, to echo Jake, thank you so much for joining us and for sticking through us a couple of minutes over the hour that we've allocated. I know that when you're looking at your revenue cycle, it can be very overwhelming. Putting together the amount of information that we compiled with all the different data sources that we looked at just to put a presentation together like this, it's a large amount of information that's getting thrown at you. And we see it every day from all of the news meetings that we have. We see so much information. I think the one thing that we all need to focus on is don't get paralyzed in fear of all of this information. Take action. Take one step at a time, then take another. Leverage a team that you have around you. One of the most amazing things that I love about working in the healthcare space is that there's such a genuine desire to help and to grow and to help patients in this industry. It's not just something people say, it's something people live and act every day. So I encourage you all to lift your teams up to that challenge. Spread the responsibility of enhancing the revenue cycle across everyone on your team. Don't take it as just your burden to carry as the leader of that team or as the administrator or the person in charge of that division, but make it the entire organization's goal to figure out a way to continue to recreate the revenue cycle, to continue to find ways to innovate and create efficiencies. Because unfortunately, at the risk of sounding like a fearmonger, if we don't begin caring about the revenue cycle more and managing it more diligently, unfortunately, it causes tons of challenges down the line for us to even be able to be here and provide care to our patients. We often put clinical needs first. I think that with the evolving economy and the changes of the times, we really need to start giving just as much attention and care and concern around the revenue cycle as we do around the clinical care that we provide for our patients. Thank you again, everybody, for being part of this call, and please stay safe out there. We appreciate what everyone is doing on the front lines to continue to keep our community safe and to provide care for people as we're going through this pandemic. So thank you to all of you.
Thank you so much, Keith. I think that's a perfect and important message to end on today. But I want to thank you and Jacob for the excellent presentation, and BHG Patient Lending for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.